Acetaminophen overdose occurs when someone takes more than the recommended dose of the medication, which is commonly used to relieve pain and reduce fever. The liver metabolizes acetaminophen, and excessive amounts can overwhelm its capacity, leading to liver damage. Symptoms may not appear immediately and can include nausea, vomiting, confusion, and jaundice, yellowing of the skin and eyes. It's crucial to recognize an overdose early, as treatment with an antidote called N-acetylcysteine, NAC, is most effective within the first 8 hours. Always adhere to dosing guidelines and seek medical attention if an overdose is suspected.
Acetaminophen overdose occurs when someone takes more than the recommended dose of the medication, which is commonly used to relieve pain and reduce fever. The liver metabolizes acetaminophen, and excessive amounts can overwhelm its capacity, leading to liver damage. Symptoms may not appear immediately and can include nausea, vomiting, confusion, and jaundice, yellowing of the skin and eyes. It's crucial to recognize an overdose early, as treatment with an antidote called N-acetylcysteine, NAC, is most effective within the first 8 hours.
Granulocytosis is a condition characterized by a dangerously low level of neutrophils, a type of white blood cell essential for fighting infections. This can occur as a side effect of certain medications, such as antipsychotics, antibiotics, or antithyroid drugs, which can damage the bone marrow where these cells are produced. Patients with agranulocytosis may experience symptoms like fever, sore throat, and increased susceptibility to infections due to the lack of neutrophils. Monitoring blood counts is essential for individuals taking high-risk medications, and if a granulocytosis is suspected, immediate discontinuation of the offending drug and supportive care, including antibiotics for infections, is necessary. Barbiturates and benzodiazepines are both classes of medications used primarily for their sedative and anxiolytic, anxiety-reducing effects, but they have different properties and safety profiles. Barbiturates, such as phenobarbital, work by enhancing the effects of the neurotransmitter GABA in the brain, leading to sedation, but they have a high risk of overdose and dependence. They can also depress the respiratory system, making them dangerous, especially when combined with other depressants. Benzodiazepines like diazepam and lorazepam also enhance GABA's effects, but are generally considered safer. They have a lower risk of overdose and are less likely to cause severe respiratory depression. However, benzodiazepines can still lead to dependence and withdrawal symptoms if used long-term. Understanding these differences is crucial when prescribing these medications to ensure patient safety and effective treatment. Voice adrenergic second messenger systems are crucial pathways in the body that mediate the effects of adrenaline, epinephrine, and norepinephrine, hormones that play key roles in the fight or flight response. When these hormones bind to V-adrenergic receptors on the surface of cells, it triggers a series of intracellular events. This typically involves the activation of an enzyme called adenylate cyclase, which converts ATP, adenosine triphosphate, into cyclic AMP, CAMP, a secondary messenger. Elevated levels of CAMP lead to various physiological responses such as increased heart rate, enhanced contractility of the heart muscle, and relaxation of smooth muscles in the airways. Understanding this signaling pathway is important for recognizing how different drugs, such as beta blockers, can modulate these effects in conditions like hypertension or asthma. Drug-induced lupus is a condition resembling systemic lupus erythematosus, SLE, that can occur as a side effect of certain medications, particularly those that affect the immune system or are involved in liver metabolism. Common culprits include hydralazine, procainamide, and isoniazid. When these drugs are metabolized in the liver, they can lead to the formation of reactive metabolites that may trigger an autoimmune response, resulting in symptoms such as joint pain, fatigue, skin rashes, and fever. The diagnosis is often made through laboratory tests showing specific autoantibodies like antihistone antibodies, and it typically resolves after discontinuation of the offending drug. Understanding this association is essential for healthcare providers to identify and manage this condition effectively, ensuring prompt recognition and appropriate treatment. Drug development is a complex and systematic process that involves several key stages to create safe and effective medications. It begins with drug discovery, where researchers identify potential new compounds through laboratory experiments and screening for biological activity. Once a promising candidate is found, it undergoes preclinical testing in vitro, in the lab, and in vivo, in animal studies, to assess its safety, efficacy, and pharmacokinetics, how the body absorbs, distributes, metabolizes, and excretes the drug. If the results are favorable, the drug moves on to clinical trials, which are conducted in 3 phases involving human participants to further evaluate safety and effectiveness. After successful trials, the drug is submitted for regulatory approval to agencies like the FDA, which reviews the data before granting permission for marketing. This entire process can take many years and requires substantial investment. But it is crucial for bringing new therapies to patients while ensuring their safety and effectiveness. Ethylene glycol poisoning occurs when an individual ingests ethylene glycol, a substance commonly found in antifreeze and other industrial products. This toxic compound is metabolized in the liver to glycolic acid and oxalic acid, which can lead to severe metabolic acidosis, kidney damage, and central nervous system effects. Symptoms of poisoning may include nausea, vomiting, headache, dizziness, and in severe cases, seizures or coma. The progression of toxicity can be rapid, often presenting with a drunken state due to its intoxicating effects. Treatment is critical and typically involves the administration of an antidote such as fomepizole or ethanol, which inhibit the enzyme responsible for metabolizing ethylene glycol, thereby reducing the formation of toxic metabolites. Supportive care, including intravenous fluids and correction of metabolic acidosis, is also essential in managing this life-threatening condition. Lead poisoning occurs when lead, a toxic heavy metal, accumulates in the body, often through environmental exposure from sources like old paint, contaminated water, and certain occupations. It is particularly harmful to children, as even low levels of lead can affect their development, leading to cognitive impairment, behavioral problems, and growth delays. In adults, lead exposure can cause hypertension, kidney dysfunction, and reproductive issues. Symptoms of lead poisoning can vary but may include abdominal pain, constipation, fatigue, headaches, and in severe cases, seizures or encephalopathy. Diagnosis is typically made by measuring blood lead levels. Treatment involves removing the source of lead exposure and may include chelation therapy, where agents like EDTA or dimercaprol are administered to bind lead in the bloodstream and facilitate its excretion from the body. Understanding the prevention and management of lead poisoning is crucial for healthcare providers, especially in high-risk populations. Monoamine oxidase inhibitors, MAOIs, are a class of medications used primarily to treat depression, particularly when other treatments have failed. They work by blocking the action of monoamine oxidase, an enzyme that breaks down neurotransmitters such as serotonin, norepinephrine, and dopamine in the brain. By inhibiting this enzyme, MAOIs increase the levels of these neurotransmitters, which can help improve mood and alleviate depressive symptoms. However, MAOIs come with dietary restrictions, as they can interact with tyramine-rich foods, like aged cheeses, cured meats, and certain wines, to cause dangerous increases in blood pressure, a reaction known as hypertensive crisis. Common MAOIs include phenelzine and tranylcypromine. Due to their potential side effects and interactions with other medications, MAOIs are usually prescribed when other antidepressants are ineffective, and patients must be educated about the importance of adhering to dietary guidelines while on these medications. Neuromuscular blocking drugs, NMBDs, are medications used to induce muscle relaxation during surgical procedures or mechanical ventilation by blocking the transmission of nerve impulses to the muscles. They work at the neuromuscular junction, where nerves connect to muscles, by inhibiting the action of acetylcholine, a neurotransmitter that signals muscle contraction. NMBDs are categorized into 2 main types: non-depolarizing agents, such as rocuronium and vecuronium, which prevent muscle contraction without initially stimulating the muscle, and depolarizing agents like succinylcholine, which cause a brief contraction followed by paralysis. The effects of non-depolarizing NMBDs can be reversed with antidotes, whereas succinylcholine's effects are typically short-lived. It is crucial for healthcare providers to monitor patients closely during and after the use of NMBDs, as they can cause respiratory muscle paralysis, necessitating mechanical ventilation until the drug wears off. Understanding the pharmacodynamics and pharmacokinetics of these drugs is vital for safe administration and effective management during anesthesia. Organophosphates are a group of chemicals commonly used as pesticides and in nerve gases, which inhibit the enzyme acetylcholinesterase. This enzyme is responsible for breaking down acetylcholine, a neurotransmitter that transmits signals in the nervous system, particularly at the neuromuscular junction and in the autonomic nervous system. When acetylcholinesterase is inhibited, acetylcholine accumulates, leading to overstimulation of cholinergic receptors, which can cause symptoms such as muscle twitching, excessive salivation, bronchoconstriction, and even respiratory failure. Cholinergic drugs, on the other hand, are medications that mimic acetylcholine or enhance its effects, often used to treat conditions like myasthenia gravis or glaucoma. Examples include donepezil, which is used for Alzheimer's disease, and pilocarpine, used for dry mouth or glaucoma. Understanding the pharmacological effects and potential toxicity of organophosphates, as well as the therapeutic applications of cholinergic drugs, is essential for managing exposure and treatment strategies effectively. Pharmacodynamics is the branch of pharmacology that studies how drugs affect the body and the mechanisms through which they exert their therapeutic effects. It focuses on the interactions between a drug and its target receptors, enzymes, or other cellular acetaminophen over